My name is Anne, and I'm grateful to be recording this presentation on the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. This presentation is about naturopathic doctors and the BC Mental Health Act, the laws, the nuances, and the hopes. This is prepared for Art and Practice of Naturopathic Medicine 200. Hope you enjoy. And these are the questions. So does involuntary treatment of mental illness under the BC Mental Health Act align with naturopathic principles of healing? And as naturopathic doctors, how do we support individuals who are involuntarily treated to maintain as much autonomy as possible? So I'd like to go over the current state of the BC Mental Health Act, which allows authorities like police, physicians, and nurse practitioners to involuntarily detain and treat mentally ill individuals who they deem 1. Requires treatment in or through a designated facility, 2. Requires care, supervision, and control in or through a designated facility to prevent the person's or patient's substantial mental or physical deterioration or for the protection of the person or patient or the protection of others, and 3. Cannot suitably be admitted as a voluntary patient. Of note, according to the naturopathic physician's scope of practice within BC, confirmed with the College of Complementary Healthcare Professionals, BC, naturopathic physicians do not have the authority or scope to certify someone under the BC Mental Health Act, as the physicians they refer to in the Act are medical physicians or medical doctors. The powers under BC's Mental Health Act are some of the most serious state powers authorized in Canadian law. Powers to detain, to administer injections, and electroconvulsive therapy without consent, to discipline patients in any way, to mechanically restrain, or to confine alone in a seclusion room. A specific aspect of this law, called deemed consent, is currently undergoing a charter challenge with the stance that it is unconstitutional. For more information on this or the BC Mental Health Act, please go to Health Justice's website listed in the references. So, with this basic knowledge about the BC Mental Health Act, I invite us to explore how we as naturopathic doctors or future naturopathic doctors can work with individuals and groups who may be receiving involuntary treatment either in the hospital or in the community. I think one thing to keep in mind is that as much as we want to challenge the status quo and do challenge the status quo of the current allopathic medical system, we are still working under influence of the system, and sometimes we may unintentionally reinforce the harms of the system. As advocates and practitioners, combining the rigors of science and the art and wisdom of nature and ancient healing, I hope we strive to take into account historical, cross-cultural, and spiritual explorations of what psychiatry labels as mental illness and specifically psychosis. My question to pose is, when someone experiences psychosis or a loss of touch with reality, is who gets to decide what reality is? Neuroscientist Anil Seth once shared in a TED Talk in 2017 that our brain hallucinates our conscious reality. In fact, he posited that we're hallucinating all the time, including right now, and it's just when we agree about our hallucinations, we call that reality. In many indigenous ways of knowing and other traditional ways of knowing worldwide, the experience of psychosis often is viewed as a gift or special power. And at the same time, it's important to realize that unguided and unharnessed, it can cause harm to the person and or their community. Emma Health Engel, a Métis individual with a diverse cultural and ethnic heritage from Toronto, wrote in their master's thesis that it was important for them to use the two-eyed seeing theoretical framework. This framework was developed by Mi'kmaq elders Albert and Murdana Marshall of the Eskasoni First Nation in Cape Breton, Nova Scotia. Emma used two-eyed seeing to navigate and develop their own integrated understanding of their psychosis experience. They realized that in the process of interviewing some healers who encouraged and practiced two-eyed seeing, that they themselves were holding a dismissive bias and devaluing of colonial models of understanding due to the discriminatory and oppressive history and their own traumatic experience with this approach. Through their research and thesis, they were able to see the mainstream Western mental health model in a new light as a valid healing method in its own right, and that there is so much diversity in healing traditions and perspectives. Seeing with two eyes allows so much more intersection and holistic understanding, and I hope to foster in myself even a sliver of that grace and appreciation of two-eyed seeing to reconcile my grievances against the modern Western psychiatric system under which I experienced a decade of oppression. The question of whether the BC Mental Health Act aligns with naturopathic principles does not have a black and white answer. As a future naturopathic physician, I hope to use elements of my lived and living experience intentionally, providing relational care to those experiencing involuntary treatment for their mental illness. I want to preserve autonomy, informed consent, and decision-making power as much as possible for my future patients while balancing principles of non-maleficence and beneficence, or more simply put, doing no harm and providing benefit. But often, in cases of involuntary treatment, the medical doctor assumes their intervention, such as restraint, seclusion, forced treatment, such as tranquilizing injections or ECT, is doing no harm and providing benefit to the best interest of their patient. But on the patient's side, it's causing harm to their mental and emotional safety, causing lifelong medical trauma. Something my friend and former colleague Rory Higgs, who works for Health Justice BC, as I briefly mentioned in a previous slide, a nonprofit charitable organization that uses research, education, and advocacy to transform the systems that shape mental health and substance use treatment in BC. Rory shared with me, it's not about never, ever, or always when it comes to supporting people through crises, and at the same time, always trying to see the person in that moment as a human and to not handle their situation formulaically as systems and processes often would have us do. It can really be dehumanizing when someone is struggling to be met with flowcharts of structured assessment. And again, going back to the discussion and two-eyed seeing, understanding where the limits of our scope and capacity as naturopathic physicians are, and drawing upon colonial systems of protection and intervention such as police, paramedics, psychiatric facilities, but only when all other methods have been exhausted. I have so much more to say about this topic than a brief presentation can do justice. So I will leave it there, but I encourage people to hold that discomfort, hold that nuance, and think about all the factors at play. In Chinese, the term for crisis is wei ji, with the first character wei meaning danger, but the second character ji meaning chance or opportunity. So, in crisis, there is always chance for change, whether that's improvement of a situation, a mindset, a move, a belief, or a deeper understanding. In conversation with my mentor, Edmonton naturopathic Dr. Christina Bjorndal, a prominent figure in the naturopathic mental health field, she expressed a dream of having NDs be the first-line treatment for everyone, to have naturopathic doctors in hospitals, and even eventually have naturopathic hospitals or integrative hospitals. I share this dream where we treat acute and chronic mental health conditions or imbalances with acupuncture, herbs, homeopathy, nutrition, physical medicine, spirituality, lifestyle counseling, and pharmacology when needed, all based on the foundation of relational care. One of the quotes she left me with, which I resonate with, is from author Joseph Campbell. "The psychotic drowns in the same waters in which the mystic swims with delight." Thank you very much.